I'm Susan Hillier. I'm Professor for Neuroscience and Rehabilitation here at University of South Australia, and I'm also the Dean of Research in the Academic Unit Allied Health and Human Performance. It's no surprise to everyone that chronic conditions are the biggest burden of disease in Australia. So, we get very concerned about cancer and other issues, and they do cost a lot in terms of lost lives and so forth. But the chronic conditions is this underground, groundswell of an issue that is contributing to our hospitals being overcrowded. It's costly in terms of lost productivity years, it's costly in terms of ill health, but the burden on the health system is actually enormous. And it probably underpins all of the stories about hospitals not having enough beds and so forth. So by chronic conditions I mean things like diabetes and heart disease, cardiovascular disease, kidney disease, lung disease. They're often largely preventable. The prevention of risk factors is not rocket science. It's good diet, physical activity, good sleep, maintaining your weight, maintaining good blood pressure, keeping your cholesterol low, stopping smoking, avoiding alcohol. So they're quite simple things to do, but devilishly hard. So what we're going to try, and what we've had some pilot data to suggest this is going to be useful, is to actually take it as a long-term strategy and buddy up people with chronic conditions or at risk with health students who are learning about these chronic conditions, and they're going to form a sort of an educative alliance, if you like, and they can coach each other about how they're going to manage these conditions. And then the student can work as kind of a health coach buddy, cheer squad, to keep them going in that process. So it's a longer term relationship. And there'll be physio students and exercise students and nutrition students. They will have their background discipline, but what we're asking them to do is step up and actually work with the person first. We hope that this will actually graduate a new kind of health professional who can look at the big picture in the person's life. In fact, look at not just the person's life, but look at the context of their life. The family drivers, the work drivers, the society drivers that are all sustaining, their smoking activity or their low physical activity, so that these students will have this appreciation for all the sort of social determinants of health, as well as, the actual specifics of what diabetes is all about. And then we also want to measure the students and what they learn, and does this in fact bring about a bit of an attitude shift, so that, for example, the medical radiation student not only learning to be a top-rate sonographer, but they'll also really demonstrate an understanding of how to work with people with chronic conditions, how to use a skill set like motivational interviewing or goal setting or behaviour change frameworks, and see if they actually change as well.